I'm Ann Makovic at the Live News Desk, and we are waiting for a news conference that is about to begin with Dr. Mark Ghaly. He is the state's top health official, and he is going to be talking about some of the movement we just saw from California counties, moving from more restrictive coronavirus situations to a little bit of a loosening of the rules. This is where we're going to end up finding that live feed once Dr. Ghaly begins speaking, but I want to show you the updated map of some of the changes that just went into effect within the past hour. You can see there in the Bay Area, we are either in the purple or the red tier, depending on the county you're in. And some local counties just moved into this red, less restrictive tier of reopening. They are Solano, San Mateo, Alameda, and Santa Cruz counties. They join Santa Clara, Marin, San Francisco, and Napa counties, which have been in this second red tier where risk is considered substantial. Some counties in the north and east parts of the state, as you can see there on your map, are now moving into the orange and yellow tiers. The state system on all this was announced about a month ago, and this is the first time that counties are actually eligible to be able to move between the three more relaxed tiers. That's because the counties have to stay at each tier for at least 3 weeks before advancing. So the counties, the Bay Area counties that just moved into the red tiers, this means that you can go back to school in person. Otherwise, counties that were in the purple had to apply for waivers in order to do that. And here is Dr. Mark Ghaly talking about all of it right now. Let's listen in.
That we're doing all we can to keep our guard up. But as I have done the last couple of weeks, I want to invite up my colleague, our acting state health officer, Dr. Erica Pond, to really walk through some of the data and where we are in testing.
Good afternoon, everyone. Thank you very much. So for today's case numbers, we have 2630 for September 22nd today, and our 7-day average is 3,473 cases. Our total tests are 131,273, and our 14-day test positivity is 3.0%. It's very important to us that our testing is accessible, timely, and equitable. It's critical to our continued response to COVID-19. Our test turnaround times within 24 to 48 hours allow for effective isolation and quarantine, which allow us to stop the spread of the virus. Laboratories across the state are reporting results in 1.2 days, with 69% being reported within 1 day and 90% within 2 days. This is a dramatic improvement in our turnaround time within the state of California. We have a new testing turnaround time dashboard that's updated weekly at testing.covid19.ca.gov. Given this, California's testing task force has issued updated guidance and is now recommending prioritizing testing of all patient population tiers equally. California has a new blueprint for reducing COVID-19 with slow and stringent criteria for loosening and tightening restrictions on activities. Every county is assigned to a tier based on its test positivity and adjusted case rate for tier assignment, including metrics from the last 3 weeks. And from here, I'm going to turn this back over to Secretary Ghaly.
Thanks, Dr. Pond. Just to re-emphasize, you'll remember really my first Zoom update on Tuesday, we focused on the new testing prioritization criteria. It's been many weeks since we spoke to that, and it was really built around the fact that at that time we were experiencing delays in turnaround time. There were access to testing issues that had popped up. Really, that was the impetus to our Perkin-Elmer partnership to bring new testing capacity to the state. But what Dr. Pond has focused on over the past couple of weeks is really an arrival to a different time where testing is more available, that turnaround times are shortened so that those test results can be more useful both to the individual who was tested, but also on the contact tracing effort from the perspective of isolation and making sure that those who are directed to isolate for a period of time do so early on in their course so we don't have the disease and transmission spread more broadly. So today's announcement focused on really changing our prioritization to say all 4 of our tiers, the tiers aren't different, but that all of them can be tested now, and that we want to support individuals who are in any of those tiers to get tested at the same rate. Again, if things do go to a place where we need to revise that because there's pressure on testing, we now have a system where we can do that. So on the blueprint, this concept of slow and stringent is really where we started many weeks ago, the governor laying that out for us and really looking at how we're going to see movement into the tiers. We had announced, really just as a reminder, that we have these 4 tiers. We have widespread, substantial, moderate, minimal. That's people are starting to talk about purple tier, red tier, orange tier, and yellow tier. That I wanted to, before we get into where we are today and over the last couple of weeks with data and where counties land, remind you of where these tiers are. I want to also say that although we'll focus on those counties making meaningful movement in the tiering system, so actually those that are changing tiers, a number of counties also did enough to control transmission that they're moving towards a change in tier. Some of these counties may be the county that you live in, and so we constantly urge you to go to our covid19.ca.gov website where you can get all of the information about each tier and which counties land where. I also wanted to mention that, as we said in the beginning, we really wanted to stick to our framework for a minimum number of weeks. That minimum was 3. And today, after consideration from a number of different sources, looking at the evidence, understanding how sectors fit into our entire framework, we are announcing a move, and we will be working with our counties and our local sector leaders around nail salons being able to move into the purple tier. So statewide nail salons allowed to begin operations. We'll be giving more information about that soon, but that is something that we're announcing today as we look at these different tiers. That will be in the purple tier once again, so widespread statewide. Looking at the operations of nail salons, understanding the number of steps that they can take to make a lower risk environment for both staff and customers, with some new additions to that sector guidance and how to set up operations in a way that is lower risk. We believe that it is, we're able to add that to the number of sectors within the purple tier or that widespread tier. So today, you'll see a number of counties moving from red into the red tier from purple, a number of others moving from red to orange, and then one moving from orange to yellow. So the red tier, again, substantial transmission. Alameda, Riverside, San Luis Obispo, San Mateo, and Solano counties all reaching the thresholds for 2 consecutive weeks, moving from purple to red. In terms of orange, moving from red to orange, we saw El Dorado, Lassen, and Nevada counties all moving there because they met the threshold criteria for 2 consecutive weeks and remained in the orange tier for at least 3 weeks before, in the red tier before moving to orange. And then one county, Mariposa, who met the threshold to move into yellow. This is, I think, a proof point that as counties are able to move, that we see them moving at all levels of transmission. So some that are just now getting case rates and test positivity down from what were pretty high rates in the late summer to being reduced, allowing those counties to move from purple to red, but even smaller counties where transmission continues to come down, as in the case of Mariposa County, seeing some counties achieve the yellow tier threshold as well. So I think good news all around, but really a reminder that we, despite seeing this steady downward trajectory, that we cannot drop our guard. People ask me on an ongoing basis, why the slow and stringent approach? And I'll remind you, we want to be slow and stringent so as we move forward, we can be best prepared in case we see some increase in transmission, that it doesn't cause us to take one giant step backward. This week, we had conversations with a number of counties about making sure that the data trends continue to improve. We looked at the data very closely across a number of counties, hand in hand in partnership with those counties to understand what they're seeing and to ensure that our thresholds are met and our data is accurate. We are seeing across the nation an increase in a number of states. We're seeing a second wave starting in Europe. Some European countries are returning back to stricter stay-at-home like orders, some additional restrictions that, of course, we've seen here in California. We were the first state to implement that statewide stay-at-home order, but we are doing all that we can to make sure our counties can avoid a step back in that way to a more restrictive level of operation. And then, as we've reminded you time and time again over the past many weeks, the flu season right around the corner. There are already conversations about how our facilities are addressing flu vaccination, creating safe, lower risk outdoor ways to provide flu vaccine to a number of Californians. And of course, our emergency rooms, hospitals, urgent cares, and clinics preparing for flu coming through their doors, making sure that we have the right PPE and testing available so that if flu does come or when it does come, we are as prepared as possible to not just take care of flu, but to distinguish it from COVID. And I'll remind you that it's never too much to plug the flu vaccine. I received mine just yesterday. I hope that many of you will reach out to your provider. If you have one, identify when you can get that flu shot. And if you don't have one, to look at your county public health webpage or the state CDPH webpage to learn where you might be able to access flu vaccines at no cost or low cost. So again, we end every week with this point that simple acts make a big difference, not just for COVID, but for flu. That wearing your mask, ensuring that you have your face covering with you, that you don't take it off when you think it's okay to put your guard down. Keep it up a little longer than you thought you would, just to make sure that we keep transmission of what has become a real sneaky and swift virus that increases transmission.
All right, Ann Makovic here at the Live News Desk. You've just been listening to Dr. Mark Ghaly, the state's top health official, talking about the transition of some of our Bay Area counties into lesser restrictions when it comes to the coronavirus. So people in San Mateo, Alameda, and Solano County are now in the red tier, joining Santa Clara, Marin, San Francisco, and Napa County. So that means that indoor restaurants can be operating, movie theaters, places of worship, retail malls, all of them with significantly reduced capacity. But this is a big deal for the local economy. And he also said that nail salons statewide, because anybody in the purple tier, which is basically everybody that is the lowest tier, will be able to open. So very good news for people who've been waiting so long to get their nails done.